Okay, so it's about 10 after 6, and Dr. Cassidy just came in, and he's like, wow. And he said, he described to me kind of what it was. He said there was things that he didn't get to see on the MRI and on the x-rays until he actually got in there, and said that it was almost like, he said some people are born with, I don't know, their thing is really, it's supposed to be here. If I had my other hand, I could do it. But like mine was like this already. So he said he'd never really seen that before. But whatever. I told him I'm grateful, and I asked him, I said, I want to ask one more time, and I want to ask the real doctor. Not that everybody else wasn't real, but I said, okay. I said, so the pain in my leg. And he said, look, he said, you might get a little bit of pain from inflammation and stuff within, maybe in a couple of weeks, 2 to 6 weeks. He said, don't panic. He said, you may get a little swelling. He said, but everything's starting to grow. I guess the nerves starting to really get better and everything, because, because all that stuff's got to grow back together. Not necessarily nerve, but, my spine. He said, so don't panic. He said, it's not that it's coming back. He said, some people think, oh my gosh, it's coming back. He said, but that's just your nerves and just everything starting to get better. Or healing or whatever, swelling or whatever. The biggest thing is, this is pretty much it. And he said, especially if you're feeling this good, this early. So what I'm going to be doing is, I asked him about the meds, and I said, what should I do? And he said, that they'll give me all 5 meds, the anti-inflammatory, and I guess whatever the oxy is, and Tylenol, and there's one other one. And he said, that they'll all say take as needed, but to basically take the Tylenol and the anti-inflammatory and the other one, to really take those, because again, you don't want to be in pain, so that you can get up and move and do stuff. But he said, the oxy and that, he said, use that just if you need it, and hopefully I won't need it. I don't want to take all that stuff, but I'm not going to be crazy either. If I'm in crazy pain, I'll take what I need to. I'm not a glutton for punishment. I've already been in pain for that long. Anyway, but he said, well, you look great. And he said, let's, and from everything else, and he said, you'll be ready to go. And so I did ask also about the walking. I said, so what do I start with? He said, start today. He said, half mile. I'm like, you got it. I said, it's raining outside. I'm like, that's all right. I'll fit it in. So it's going to be awesome to say, I'm going for a walk. Y'all, those little things, that you just take for granted. I have not been on a walk since I did one December 22nd, and that's because or December 21st, and that's because I had one of my epidurals. And so they had put pain meds and stuff down in my leg and went through my back and all that. So I was feeling pretty good on that, but about 6 minutes in, it started hurting into my walk. I walked Slade, walked my dog, and that was it. So I did a lot of walking when I was at College Nationals. Of course, I was in horrible pain there. But I've not got to go on a walk, like let's go take a walk and actually feel good before September. So it's 9 months. So it's gonna be nice to go. I gotta go for my walk today. That's gonna be pretty dang on awesome. And just have maybe some back pain and no leg pain. So I'm blessed. I just want to thank everybody for all the prayers and well wishes and everything, and I'm grateful. God is good, and I will not take walking for granted anymore.
This is a crate from Cubico. Each crate has an awesome science, art, or engineering project inside. Parents can order online and it ships right to your door. Learning has never been so fun or so convenient.
It's loud out here. It's like the nurse's table right there. So there's just people and walking and talking and everything going on. So, okay, it is a little after 12, and I am headed home. I have on my wheelchair packed up. The guy packed it up. I have one of those toilets, bedside toilets, but it can fit on the toilet seat, on your actual toilet, because it has the handlebar things. Not handlebars, but y'all know what that is. I washed my face really good, but I don't know what that still is. But anyway, that's gonna go where you can do it on the toilet, because getting up, I'm in a really short chair right now. Back was hurting a little bit, still aching, and I was like, I gotta get out of that bed. The support is just not that great. So I put my little brace on, and I've been sitting in the chair. I had the PT guys come by, and they showed me things, and I felt a little bit better when I came back and went, oh my God, that chair is short. So that's why it's way low. So that's why it was a little hard to get up. But they also showed me, I have a split level house, so they showed me, we went down the stairwell, and just made sure I was able to do that. Because of course, no bending, twisting, and lifting, biggest things for 3 months. Lifting more than 10 pounds. It's gonna be the hardest one. But I've had the last of my meds. And I'll kind of go over that, of what they say that you really should take, and then the other things that you can take, depending on kind of how you're feeling. Sorry with the other noise, because it's been my room, so that's the hallway going down. My TV. So, like I said, they ran out of rooms, or booked, solid, not booked, whatever it is. So, anyway, it's been going really well. They called me the star patient today. That's what they've been calling me out here, so that's good. But like I said, your whole mind shifts with the other pain gone. I even asked, I was kind of like, God, my blood pressure's been so low in here. And, not necessarily low, but lower, and just in normal. And I was kind of like, is there something else? Because I've been taking it. They were like, oh no, you're relaxing in the pain. And I had to remember that being in constant pain, like they said that adds to your blood pressure, because my blood pressure's been up, but so the pain, and I haven't been taking, I don't take medication, so there's been 9 months of pain. I don't take Motrin and all that, but I'm taking my stuff here, because as I said before, you shouldn't be going, oh, I can withdraw the pain, because they want you to move around and to do stuff. And they said it's pretty bad if you let the pain get there and then try to lessen it. So I will be taking my meds for the hours and stuff, and I will be going that route. And I'll be walking today too, so like I said, that'll be good. They did give me a walker, but they were like, just in case I need it, and I may be somewhere and get tired and I need to have it, so I'll probably use it maybe even for my walk, who knows. But yeah, so I'm gonna be going home noon. Just waiting for my son to get here. Didn't call him earlier because they said it was going to take a little bit of time, so that's about it. And, you know, I'm feeling, just the release of, just the relief, basically. You know, like I've said, and I'm sure I'll say it every time I'm on here, you know, knowing that your leg is better and everything else, I can handle the other pain. I can do what I need to do for the rest. You know, just knowing that is gone. You know, I can deal with this other pain. This other pain is temporary. Like I said, I've been as much pain as I've been in on the other. I can do this. So, I guess that's it. And I will continue to keep you guys updated.